Good afternoon, and again, I want to say welcome. My name is Ashley McBride. I'm the State Director for Our Future Pennsylvania. We want to thank you for joining our virtual press event today, highlighting the need for strong investments in home and community-based services in the final reconciliation bill. We will hear from home care workers and elected officials calling for the Better Care, Better Jobs Act to be included in the Build Back Better plan. The bill would empower home care workers and allow seniors and people with disabilities to receive care in their homes instead of a facility. I want to get started by saying thank you so much to the home care workers with SEIU Healthcare who are joining us today, and of course to Senators Casey and Senator Brown who will speak with us. This is again a roundtable. If you're joining us, you will note that you will not be able to speak necessarily unless you're one of our panelists, but we do encourage you to follow the instructions that our organizers will put in the chat and on Facebook to let you know how you can ask a question on today. Again, just a few housekeeping rules. Want people to know if you're just joining us, you might note that you are muted and you can't speak. And that's just, again, we want to make sure that we can give all of our attention to our panelists. But if you have questions, there will be instructions in the chat box of how you can ask that question. And we will make sure we'll do our best to make sure we get to as many of those questions as possible. And if we don't get to a question today, a member of our team will follow up, and we will also share the contact information for each of our senators so that you may connect with their offices offline. Again, we want to say thank you. And so I would be remiss if I didn't take this opportunity to particularly to say thank you to SEIU, who is a partner and a friend who does tremendous work. And again, we're joined by healthcare workers across the state lines today to talk about this very important issue. For those who have joined and may not be familiar with For Our Future Pennsylvania, we are an organization, progressive organization that serves as a hub to work to mobilize Pennsylvanians on issues and elections that empower them to create lasting change that benefits families and communities. Some of that work includes connecting the public with important stories like the ones we will hear today from home care workers in Pennsylvania, Ohio, and West Virginia. Before we hear from Senators Brown and Senator Casey, I'd like to open the floor up to my new friend, Amina Nash, who is from Toledo, Ohio. And I'm so glad that Amina has taken time of her day to join us and to really tell us her story. Amina, welcome, and I'm turning it over to you.
Okay. Hello, everybody. My name is Mina Nash. I live in Toledo, Ohio. I have been in the healthcare field for like 16 years. I have 9 children, 5 of my own, 4 I'm raising my little cousins. I chose to be in the healthcare field because I feel it's my passion and I believe I can make a change in others' life. Working in the healthcare field is hard with raising 9 kids because I don't have enough time to spend with them and be in their activities. I have to work 7 days a week to make sure ends meet, to be able to pay my bills and to be able to provide for my kids. Um, as I said, I don't have enough money to at the end of each week to make sure all of my kids get what they need. So I have to like separate what I can do. So on I'm on here today to see if we can get help with, a higher pay. We as healthcare workers would like if we can get insurance benefits because the company I have right now insurance benefits and I really do need insurance benefits so that way I can stay healthy, that way I can be able to go out and participate with my clients and to make sure they are in a safe place. I also would like to ask if we can have proper PPE when we go out to these clients. That way I can be safe and I can make sure that they are safe. A lot of them does not have the proper PPE. Sometimes my job does not have the proper PPE either, but I still go out and purchase it because I love taking care of the clients that I have. I also want to say we as healthcare workers would like to be provided with the best benefits so we can care for our families, our staff, our safety, and also our community and clients' safety. Today mean a lot to me because I'm able to get my voice heard of, why we need better jobs and why we need better care. And the most part for me is the safety of my family and my clients. So this is all I really have to say. I just take hope and make that y'all take in consideration, the hard work and dedication that we do put out here for, the clients and our family and ourselves too. And I just pray that, you guys take in consideration to everything that everyone is going to be saying today. Thank you.
Amina, I just want to say thank you so much for the sacrifices that you make each day, for what you do and how you give back and show up in your community. We thank you for your willingness to share your story. And I know that both of our senators hear you loud and clear, and they have been fighting for that and will continue to do so. But thank you so much, Amina.
Okay, thank you.
At this time, I am so excited. Someone who I call my friend, Risa Kosoff, who is she does all things in Pennsylvania, but she is a remarkable woman. She is also the state council director for SEIU in Pennsylvania. And I want to turn it over to her at this time. Risa.
Oh, thank you, Ashley, so much for those kind, very, very undeserved words. I really appreciate it. I have the honor today, number one, of sitting here and fighting for the Better Care, Better Jobs Act, and also to have been fighting for home and community-based services along with all of these wonderful folks that we have on the line throughout this entire year. But really, for the better part of 7 years with SEIU Pennsylvania. And I am very proud today. We're actually going to switch up the order a little bit here due to a scheduling concern and hand things over to our neighboring senator from Ohio, Senator Sherrod Brown, for a few remarks.
Thank you, Ms. Kosoff. I didn't know I was going next, Senator, but I'm fine either way. So thank you so much. And thank you. I wanted to thank Ms. Nash. I know that she has to go, and I enjoyed our conversation ahead of time before all of you joined. I was hearing about Ms. Nash and her sister and brother, and she's followed in the footsteps of her mother and made her mother her mother's passed, but made her mother really proud. So proud daughter of Toledo. So Ms. Nash, thanks. And hearing your story both before and then what you said to everybody, you work harder than damn near anyone I know. And you're doing some of the most important work in our state. That hard work for so many Americans, and you are a poster child for that, simply isn't paying off like it should. Politicians and state government, we have a pretty corrupt, pretty incompetent, pretty mean-spirited state government in Columbus, unfortunately. Politicians in state government took away collective bargaining rights without the bill we're talking about today, without the federal investment that Senator Casey has led the effort and fought so hard for in our neighboring state. They've been one of the only tools that care workers had to earn higher wages and better benefits, have a voice in our economy. Without caregivers like Ms. Nash and Ms. Fox and Ms. Weir, no other work would be possible. And that's to me infrastructure. It's not just, not to be partisan here, it really isn't that Republicans look at it for infrastructure in the very traditional water, sewer, highways, bridges. We're all for that, Senator Casey and I, but they don't think about the human side. And I want infrastructure to provide opportunity for people, workers and caregivers and others and parents to be able to launch their children. And Ms. Nash has a big family and she wants to launch them into better opportunities than any of us have had. It's time we treat caregivers, who are so often women of color, with the dignity that you deserve and treat your work as the essential family infrastructure that it is. It's what our Better Care, Better Jobs Act will do. Our plan invests in home and community-based services so more Americans can stay in their homes as they age. It invests in this essential workforce, ensuring more support, ensuring higher wages for caregivers like Ms. Nash and her colleagues. And Senator Casey and I will keep fighting to make sure this is included in the Build Back Better plan. It was in President Biden's original plan. It's something he campaigned on. It's something Bob Casey has devoted much of his career to fight for. We have a president finally who understands the power of a union card, who understands the dignity of work, who understands the dignity that comes when seniors and Americans with disability can get the care they need at home. My mother-in-law, who has passed in her early 60s, was a home care worker. And I did not know her because I've only known my wife for 20 years, but I know how hard she worked and I know how little she was paid. And that's just wrong. We're seeing this kind of dignity of work theme, and we're seeing that seniors and Americans with disabilities should get the care they need at home. We're seeing that in plans like this one that Senator Casey's working so hard on. We'll keep lifting up the voices of workers, the seniors and Americans with disability who rely on them, focusing our efforts also on SSI, making sure that disabled people get the respect and care from the government they should. We will continue to work to get this done. I'll turn it back to Ashley and Teresa. Thank you again.
Thank you so much, Senator. Greatly appreciate your comments and absolutely appreciate you being here today. I am now going to turn it over to my home state senator, Senator Bob Casey, who has been championing home and community-based services. We like to call him our quarterback of care here at SEIU. And we're just so proud to have him lead the charge on the Better Care, Better Jobs Act. So Senator, I'll turn it over to you.
Well, Risa, thanks so much. Thanks for your leadership and the leadership of SEIU throughout our Commonwealth and throughout the country on so many issues, but especially in our efforts to expand home and community-based services for seniors, people with disabilities, and of course to lift up finally, after all these years of people talking about it, lift up the workers, the essential heroic workers that some of whom are joining us today. And I'm especially grateful that Amina got us started talking about her life, the work that she does, the work she does on behalf of clients. So many of these workers become part of a family. We had a mom from southeastern Pennsylvania talking about her son, Cole. Her name is Victoria, and she talked about how the people that work with her, and especially the one individual who's working with her son, Cole, all the time, are family. And you could hear that same spirit in what Amina said when she was talking about the safety of her own family that she's concerned about and should be, and the safety of her clients. And we're grateful that people like Amina, as she said, devote her passion to make a change or a difference in the lives of people that she serves. So that's really what a big part of this effort is about. It's of course an effort to provide millions, literally millions more seniors and people with disabilities with these home and community-based services. At the same time, this is about those workers who were always essential, but ever more so essential and even heroic in the midst of a pandemic, risking their lives. And as Amina made reference to she made reference to PPE, risking their lives in the middle of a pandemic when they're going into homes to serve people, to, in a sense, minister to people who in the middle of the pandemic. I can't even imagine the level of courage and commitment that takes. So what we've got to do is make sure that those workers can join a union and therefore have better pay, better benefits. If we really say, or if we really believe what we say as Americans, we all say it, don't we? You hear it from politicians all the time, both parties, both houses, federal government, state government. We all say the same thing. We all say we care about children. We all say we care about people with disabilities. We all say we care about seniors. Well, why are we paying those who take care of children and seniors and people with disabilities such low wages? We've got to lift up this workforce and accord them the status that we claim to accord them. It's one of those instances where we can have our values catch up with our rhetoric, and it's about time we did it. This is a great American idea. The most powerful country in the world, through this policy, can literally say, not just we're putting our money where our mouth is or where our rhetoric is, but we're going to invest in these workers because they are so essential to the lives of our families, our mothers, our fathers, our children, those loved ones in our families. You know, the New York Times always has lots of op-eds. I just happened to save this op-ed from August. Here's what it said. Honor home health workers. That was on August the 15th. And here's what from this op-ed. It said, and I'm quoting, "Direct care aides are invaluable to patients and their families." If anything, that's an understatement. But I like the fact that that opinion piece in the New York Times talked about honoring these workers. The best way to honor the workers that are with us today on this call and so many other efforts that they've undertaken to pass this Better Care, Better Jobs bill, the best way to do that isn't simply to commend them and pat them on the back, and we should continue to do that because of the work they do. The best way to honor them is get the bill passed. Get the big bill passed, and as part of that, the Better Care, Better Jobs bill. Now, we named it that because that's exactly what it is. It is better care for seniors and people with disabilities. It will be better jobs for those workers. And it will be better support for those family caregivers all across the country who have given up so much of their lives to care for someone they love. I think one of the best summations of this was by a young woman in Philadelphia, Lisa Savage, who gave up her career of more than 20 years to take care of her son, Brandon, who was home on a college break and was left paralyzed after being shot. Here's what Lisa said. She said it well, quote, "As a home care worker, we are essential. Just as our firefighters, nurses, teachers, we are essential because we care for older Americans. We care for people with disabilities at home." She had it right. These workers are essential, and it's absolutely essential for us to make sure that we lift them up and accord them the status that they have a right to expect in our society. Last thing I'll say is this isn't just good for workers, for seniors, for people with disabilities, for family caregivers. It's also great for our economy. You know, one of the great economists is Mark Zandi from Moody's Analytics. Here's what he said. I won't read you the whole report, but here's the title of this report. This guy's an economist. He's not some, member of my staff. His says macroeconomic impact of home and community-based services expansion. He talks about a short-term and long-term lift to the economy. That's what an economist says. He talks about this policy creating lots of jobs. We believe it'll create at least 500,000 new jobs, in addition to over 1 million people who can get back to work because they know that the person taking care of their mom or their dad or their loved one is someone that we, through our efforts, have invested in and have paid tribute to use the words from the op-ed, that we've honored that worker. That's why that family member can get back to work. So I'm grateful for all the work that you do every day for these families. Grateful for the work you're doing to help us pass this bill as part of the larger piece of legislation. And we're going to keep going till this work is done for better care and better jobs. Thanks very much.
Thank you so much, Senator. I think you bring up very valid points. One of the things that we have been faced with is a lot of times people are disconnecting what this means. So if they don't have a family member who necessarily maybe works in healthcare or someone who's been impacted, a lot of times they don't see how it all ties together. So thank you for that. I really want to ask a question. We have 2 more stories, and so we'll make sure to get to them. But want to give an opportunity to Senator Brown also to respond. Just from our conversation today, it's clear to see how this would help seniors, people with disabilities, workers, and families. But again, reminding people how this would expand home and community-based services and how it helps our economy as a whole. I think Senator Casey kicked it off wonderfully, but I do want you to have an opportunity if there's anything you'd like to add, Senator Casey, and Senator Brown, if you'd like to respond as well.
Well, let me say it this way. No one in the Senate, not a single member of the Senate can say it better than Sherrod Brown. He's the #1 advocate in the United States Senate for working men and working women. And he knows the value of this. That's why when we introduce this bill, sometimes you introduce a bill, you don't know who's going to jump on board. Well, Sherrod Brown was among the very first 3 or 4 people to jump on board and help us do this. So Sherrod knows it better than I do, but I'll turn it over to Senator Brown.
I'm not sure if we lost Senator Brown.
Oh, maybe
We will
we lost him.
make sure- We might have lost him. We'll make sure we'll come back for him. If Senator Casey, if you have a few more moments, just want to make sure we have another story we want to share with you today. Actually, one of your constituents, Chastity Fox, she is a home care worker and union member from south of Pittsburgh, Pennsylvania. She takes care of her mother and another consumer. She has joined us today to share her story and really to share her story and her insights. So I would like to turn it over to Chastity at this time.
Sorry, I couldn't unmute my phone. Good morning, and well, I guess it's afternoon now, but I appreciate you, Senator Casey, to be on this call with us. It means a lot to me, and I'm sure a lot of other home care workers. My name's Chastity Fox, and I'm a caregiver from Monongahela, PA, and I'm a member of the SEIU United Home Care Workers of PA. I've been a care worker for my dad for 5 years, 3 years with PPO, and he has a list of ailments, but some of the big ones are kidney failure, Parkinson's, and heart disease. I support my dad with pretty much all of his daily tasks. I help him use the bathroom, dress himself, manage medications, manage his money, cook and clean, just a few of the things I do. And it's important to me to be able to provide him care at home to help him maintain his dignity and independence. And as him being a prideful man, he would really rather stay at home. My dad was just hospitalized for 4 weeks and went directly from the hospital into a skilled nursing facility. And during that time, I have 4 children, and they weren't able to see their pappy, and they were really bummed out about that. But with all the COVID regulations, they only had 1 visitor at a time, and I had to schedule time in the nursing home. So my kids who love their pap didn't have the benefit of spending time with him as they would in his own home. And even though I love being able to provide my dad with the care he needs, this job is pretty tough for my family. I'm only making $12.25 an hour, and I work without any benefits like health insurance, paid time off, or holiday pay. I believe that caregivers deserve higher wages and fair benefits. We've been working and caring for our consumers throughout the pandemic, and places like McDonald's are starting off their employees at the same hourly rate that I'm making after 5 years in the field, and our pay rate hasn't budged throughout the pandemic. I don't think that's right, but what can we do about it? We can do these things to make sure that the different bills get passed, and especially this big one. We can't live off the wages that we have, and we deserve to be able to meet our basic needs and provide for our families. The union's been fighting for Congress to pass Biden's Build Back Better agenda and investment in care, because caregivers deserve good paying jobs and union jobs. I actually opened for President Biden at the Amtrak station in Pittsburgh when he did his whistle stop tour, and that was definitely an honor. Making this historic investment in home health care would help caregivers like me get out of the paycheck to paycheck mindset, and it would also help us build brighter futures for our families. We devoted our careers to caring for other people and need Congress to care for us also. We need fair wages, fair benefits, and a path to unionization for all home care workers. It's time to get this fight over with, and the finish line is on the horizon. Thank you, Senator Casey, again. I would thank Senator Brown if he was on the call, for supporting our home care workers and for spending your afternoon to hear our stories and to help us get the ball rolling.
Thank you so much, Chastity. And just I want to step in here. Senator Brown has certainly sent his apologies. He had to step away to deal with a legislative matter. So it sends his regards and his apologies. Again, if there are any additional questions or comments or concerns for the senator, we'll make sure that his contact information is, but he did want to say thank you to each of you all who have joined today. And again, apologizing for having to jump off early. Again, we know that the work never stops. So we are so happy and elated that he could join us today. We have one final story on this afternoon. I am happy to turn it over to Shaylin, who is a home care worker and union member from West Virginia. She's also currently studying to be a surgical technician. Shaylin will share her story at this time, and so turning it over to you.
Hi, my name is Shaylin Weir. I am studying to be a surgical technologist at PTC right now. I have been a healthcare worker for a little over a year now, and I've seen it's been a long haul to this point. There's been a lot of ups and downs through COVID and just a lot of regulation changes and things like that. But I am currently making less than $12 an hour, which for a normal student is good, but I am in college, so it's not great. $12 an hour doesn't really let me pay my bills and put gas in my car and feed myself 7 days a week. So it's a struggle to decide what I'm going to do that day. On a typical day at work, I cook meals, clean, mop, dust, sweep, do laundry, make sure my consumer is well fed and shows up to all of her appointments on time. So basically, I act as a chauffeur, a personal chef, a maid, all those things. And their wages are a lot higher than what I am currently making. I do love my job. I wouldn't want to have any other job. After I do graduate with my degree, I do plan to come back to the home care work. As for the bill, my union is fighting for Congress to pass President Biden's Build Better agenda, an investment in a career because caregivers deserve good pay and union jobs. I joined the union because I had previously been in a union at my other jobs, and I know how important it is for employers, for coworkers to stick together to get things done. It's time for Congress to invest in caregivers and the consumers who rely on our care. Thank you, Senator Casey and Senator Brown, for supporting home care workers. It truly means a lot to us.
Shaylin, I want to say thank you so much for your willingness to share your story. Certainly, we want to send you well wishes in your academic pursuits. And again, thank you for being with us today and for what you do every day. So again, I'd be remiss if I didn't take this opportunity. Again, I said thank you to Shaylin, but to Amina and Chastity for joining us. And of course, to both Senator Brown and Senator Casey. Before we leave, I want to give an opportunity for Risa again, who is the SEIU Pennsylvania State Council Director, to give closing remarks, and then we will turn it over to Senator Casey for any final remarks. But again, we want to say thank you to each of you all. And before you jump off, after they speak, we do have a call to action. We could not have this event without a call to action, without telling you how you can become involved and what you can do to make sure that you're lifting your voice. Risa?
I just wanted to jump ahead of Risa for 1 second. I've got to run because we've got this caucus meeting. We're going to learn about what's going to happen with this debt ceiling. So I'm running late for that, but I want to thank everyone for being on the call. Risa and Ashley, I know, can conclude the call when they're ready. But I want to especially thank Chastity and Shaylin and Amina for sharing their stories. We're going to get this done, and you're helping us do it. Thanks very much, and God bless your work.
Thank you so much, Senator. All right, Risa, it's on me and you now.
I hope we can hold this down, Ashley. Ashley, as per the usual, I think you have said it all without need to say more, but just my sincere thank you to Amina, Chastity, and Shaylin, home care workers from across our region who have been willing to speak here today to demonstrate the need of how important it is to invest in home and community-based services in the upcoming reconciliation package, and to get better care, better jobs across the finish line. It's been far too long, and absolutely this needs to get done for our workers, for our consumers, for our older and disabled Americans who critically need these services. And just, it takes a lot of courage and guts to get up here in a forum like this. And I just want to, express my gratitude, and then of course my gratitude for our senators, Senator Casey and Senator Brown, who have been really spearheading the fight in Congress. So Ashley, I'll turn it back to you.
Thank you so much, Risa. And again, thank you to each person who has joined us on this afternoon. So it would not be an event, it would not be a party if we didn't allow and encourage everyone to join us. One of the things about it is sometimes we really are trying to figure out what can we do. It seems so massive, and it seems as if things are impossible. The reality is that it is possible, and it's possible because of each of you, because of each of one of us, making sure that we're lifting our voices. And so whether you are from West Virginia, if you're from Pennsylvania, if you're from Ohio, if you're from any other state across the country, you have an opportunity to make sure that your members of Congress are hearing you. So what we want to do is invite you to join us in supporting Care Workers Deserve Better. We want you to use your voice and speak out to tell your members of Congress loud and clear, we support and need these historic investments in our care. You can do so by signing our petition, https://FOFPA.link/care. So again, we'll leave it up. We'll make sure that it's shared in our chat. But again, so if you have found out any new information, good information, make sure that you are sharing it with your family, your friends, your colleagues, your coworkers. Sometimes it seems like these things are so disconnected, but we know that we can lift our voices and we can make this thing happen. So we encourage you to follow us on social media. Our social media channels are there. And again, just want to say thank you, certainly to SEIU for the amazing work that you do for supporting workers across the country, particularly to our friends in Pennsylvania, West Virginia, and Ohio. We want to say thank you. We hope that each of you all have a wonderful day. And don't forget to sign our petition and make sure that you're sharing it with all that you know. We can do this thing together. Have a wonderful day.